Even as organizations quietly shift their language, my guest on this episode is direct about health equity and about what it actually takes to sustain it. Listen to hear how community-based workers are fighting for funding, why relationship building is a real leadership strategy, and how she's leading through one of the most strained moments in public health. You're listening to the PHEC podcast, episode 470. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, epidemiologist, entrepreneur, author, and your host every Tuesday since 2017. I have over 2 decades that I've invested in working at the intersection of health, community, and meaningful change. My book, The Public Health Consultant, Expertise, Entrepreneurship, Greater Impact, publishes December 2026 with Johns Hopkins University Press. Outside of this podcast, I lead Dr. C.H. Huntley, LLC, partnering with large nonprofits, government agencies, and tribal nations on strategic planning and implementation. Lately, much of our work has centered around workforce development, actually helping organizations build the capacity they need to serve their communities well. That work and this podcast are driven by the same passion, helping public health professionals and the organizations they lead create real change in communities they serve. Let's dive in. I'm very excited to introduce you to my guest on this episode. My guest is a senior director at a national nonprofit working at the intersection of public health, healthcare, and community. We talk about what health equity actually means in practice, from housing instability to chronic disease, and why community-based workers on the front lines need sustained funding. We also explore an unexpected leadership strategy, using relationship building and self-care to sustain partnerships during one of the most difficult and strained moments in public health. Let me formally introduce her, and then I'll connect our conversation. Jacquelyn Dalton is the Senior Director of Special Initiatives and Projects at Health Leads. She brings over a decade of experience in public health, community health, and health equity leadership. Prior to Health Leads, Jacquelyn focused on addressing health disparities through academic research, community engagement, and community health programming. Driven by a deep commitment to social justice, Jacquelyn is passionate about making a lasting impact for future generations through collaborative initiatives and partnerships that uplift historically underserved communities at all levels. Jacquelyn holds a bachelor's degree in biology from PHEC University and a Master of Public Health from Tennessee State University, and is currently pursuing a doctoral degree from Johns Hopkins Bloomberg School of Public Health with a concentration in health equity and social justice. At the end of today's episode, I'll tell you how to find an exclusive follow-up conversation with my guest that lives inside of our private community. Let's connect my conversation with Jacquelyn. Are you a public health professional thinking about starting a consulting business or exploring entrepreneurship? Then the Public Health Entrepreneurs podcast is for you. Visit publichealthentrepreneurs.com or search Public Health Entrepreneurs wherever you listen to podcasts. New episodes are released every Thursday. Hi, Jacquelyn. Welcome to the podcast. How are you today?
I'm doing well, and thank you so much for having me.
I am very excited for our conversation. We've been chatting a little bit backstage, I often will do that anyway, getting to know guests and just chatting a little bit before hitting record. And I realized I have so many questions and I didn't want to go too far and then have to start over with recording it. So why don't we start with you just introducing yourself? Why don't you tell us a little bit about what you do? And I'll just let you, as much or as little as you like.
Well, thank you. So, again, my name is Jacquelyn Dalton. I am born and raised in Middle Tennessee, and I currently live in Nashville, Tennessee. I'm a wife, a mother of three boys. I've also been working in public health for a little over 12 years now, and I ultimately got my start in public health and health disparities research and some programming on the campus of Fisk University, but also at Meharry Medical College. So I've been doing that over the years. It's something that brings me a lot of joy, and so I'm excited to be here today to talk about that.
Oh, that's awesome. Like you said, 3 boys. Okay, that puts into context.
Yes.
How old are your boys? I just have to ask.
Oh, this is gonna be a funny one. I actually have an 18-year-old son, a son that's about to turn 14, and I also have a one-year-old. So God is funny, and we're just laughing along.
Oh, I love it. I love it. I have 2 boys and a girl. So, of course, they're all adults, but I don't know, I guess I thought my boys obviously thought that when I was pregnant with the 3rd, it was gonna be a boy, and they were a little offended when they found out it was a girl, but I think they've, somewhat gotten over it since they're adults now and in focus,
Hopefully,
but
yeah.
wonderful. And Middle Tennessee, so we're not too far about apart. I'm in South Carolina. And I like to spend one of my favorite places is like East Tennessee, Western North Carolina, that, Smoky Mountains, that area.
Beautiful. Yes.
Yeah. Well, wonderful. Thank you for making time to be here. This is going to be a conversation where I get to know more about you and your work. And before we dive too much into right now, I always like to kind of paint the path of where did you start, kind of build up to where you are. Tell me a bit about when you first learned about or heard about public health or maybe considered it as a career.
Great question to start with. I always say I love public health. I probably eat, sleep, breathe public health. But where did I get my start? I would say that honestly, it was probably in undergrad where I got my start in public health. I had a wonderful advisor, Patricia McCarroll at Fisk University. So shout out to her. But she was amazing on top of being a biology professor. But she recommended to me one time I was having an advisory session, she recommended that I participate in a couple of summer programs. One of those was the summer medical and dental education program at Case Western, or it was a really great program that really allowed me to focus in on not only shadowing someone who was in healthcare and working with a health professional, but also we focused a lot on public health initiatives. And I had the opportunity to work with a group of fellow students, and we developed a program or initiative, an effort to prevent lead exposure for small children who were living in older homes. And so that really kind of blew my mind a little bit like, that's really interesting. Healthcare is not only about the treatment piece, it's also about thinking about people's health in our community and exposure to different things in our homes and in our neighborhoods. And so that also led me to another program. I think that was really pivotal in my experience as being a student is the HBCU Wellness Student Health Ambassador Program. That was also a recommendation from my advisor. And in that program, we really did a deep dive in health disparities. It started to help me really make sense of public health because public health and talking about health disparities, it's something that when you ask me about my start, I think, I feel like I've always been growing into this career, but it really gave me the language to something that I had been seeing growing up. Like I said, I grew up in Middle Tennessee and Columbia, Tennessee. I remember noticing certain things about the health of our communities. Church members passing away from different chronic diseases, or just how demographically our neighborhood and our city was set up, right? You start to see some differences there. So that program allowed me to gain the tools to better understand and describe the situations that I was seeing. And it also gave me the ability to understand how to develop solutions to solve some of those things. Because you always wonder, like, why is this a thing of my community? And how do I solve this? So as a student health ambassador throughout my matriculation at Fisk University, I was able to gain experience doing preconception health trainings with some of my fellow students on campus, but we also did some programming in the neighborhood, working with a well-known clinic, Matthew Walker Comprehensive Health Center in Nashville, Tennessee. We did some programming around maternal health and infant health. And that really started off my interest in my career in public health because I was able to gain my first big girl job in public health after participating in those summer programs. And so those experiences really kind of jump started me into then working more in health disparities research at Meharry.
I can relate to that personally. And after, I interview so many people on this podcast and I ask this question, I'm always fascinated to hear, how people, first discover public health and that whole transition. I know personally, I can relate to when you described like finally having the words to explain or to describe what you've been witnessing and experiencing for so long, especially in the community, because that's a lot of how I felt. I was much further along before I really discovered public health in terms of my career because I'd worked in healthcare for so long. But I definitely understand that, it's like, oh, this is actually a thing. It has anyway, that was I definitely get that. And a lot of my guests have described something similar. I'm curious, is there a particular population or issue that you're really passionate about now?
That's a very tough question, especially for
Yeah.
someone working in public health because public health is a
You
little
like
bit
all
of
the things.
everything. Yeah, but in addition to I'm most passionate about health equity and eradicating or somehow addressing health inequities. But if I had to say one issue area, I might say chronic diseases in general. So cancer, diabetes, heart disease, and even mental health. I know some folks don't think of mental health as a chronic disease, but it is something that you live with for a long time. And so adding in mental health as a chronic disease is very important as well. I think any of those things that are very preventable, where you see lots of disparities and even inequities having that kind of dynamic impact on the lives of folks in your community, I think is really at the center what hits home for me because I saw that, like I said, so much growing up. It's impacting my own family members, and I think that's something that I'm also always thinking about. How do we prevent chronic diseases at a higher level?
Yeah, yeah. Well, let's move a little further up the timeline to talk a little bit about what you're doing now. Tell me about what you do now and maybe kind of connect the transition to this current role.
Yes. And I know you asked me about that previously. I did not mention.
Uh,
I'm actually a senior director at an organization called Health Leads. It's a national nonprofit organization. And this role really sits at the intersection of public health, healthcare, and community health. Health Leads is an organization that is actually this year celebrating its 30th year of existence. So it's our 30th anniversary. And Health Leads really got its start all those years ago with the founder, Rebecca Oni, really just making the case for social needs, right? Saying that healthcare isn't the only thing that's going to keep people healthy. And I think she has a viral TED Talk that's called "What If Our Healthcare System Kept Us Healthy," where she's really making the case for using waiting rooms and those opportunities when folks are within the healthcare walls to also talk about those other things that contribute to one's healthcare, like housing, like food, like transportation, all of those things. And so over the years, Health Leads has really evolved into not just shifting and making the case for social needs, but making the case to engage individuals who are residents or community members in healthcare as well. And for me, I believe that, so I have to say this. I have a faith leader that always says that faith doesn't start until you leave the church, right? And I feel the same way about healthcare. Health doesn't start until you leave your doctor's appointment or until you leave the hospital. And that's what I really love about Health Leads is that throughout those 30 years, they've been really making the case for why we should focus more on what's happening outside of the clinic walls or outside of the hospital walls. And Health Leads is really about now it has really evolved into being an organization that really wants to see everyone have what they need to be able to achieve health or to be healthy by their own means. And so we really believe in engaging community members, community leaders in those conversations where we're talking about how to develop a health solution. So all of the work that I do is about bringing together different partners with individuals who are actually impacted by the issue that we're trying to solve for to help co-design some kind of solution that can be around food systems, it can be around healthcare. Lately, we've been working on in the technology space, working with community-based organizations to help develop their own technology solutions. And so that's really the work I do, is helping to bring together partners that may not usually work together to develop a common solution. And I think that's so important because why would you not have the individuals who are going to use your tool at the table to help develop it? So that's really important to me and really what my day-to-day work looks like.
I absolutely love so much of that. I think that for someone who came from a career in healthcare, that in a transition discovered public health, and as I learned public health, learn more and more, I really realized that it's not, although we tend to use healthcare to help explain what public health is. It's healthcare is this, and then public health as a comparator, but it's not either or. It's both and. So I really appreciate and love how you describe, I guess, the vision or the focus of the work that you do at this intersection of healthcare, public health, and community, because that's the other piece of that. We talk often about involving the community, but what happens too often is a group of professionals, well meaning, will develop something and then just take it to the community instead of co creating it with the community. So I really, really love hearing all of this. Could you tell me a little bit more about some of the programs? And you mentioned, technology, but of the programs that you oversee, what stands out the most, or what is, really having maybe a really great impact, or is it standing out in terms of popularity or just in any way? I'd love to hear a little bit more about, you can pick one or two, but a little bit more about what that looks like and how do you get the community involved, and, just a little bit more of a deep dive, if whatever, however far you can go into it.
Well, one of the things I do is I lead a national network of organizations called the Health Equity Community Collaborative. And this is a organization or a initiative within my organization that is all about bringing together individuals who are health equity practitioners or health equity advocates to support them in continuing to do this work. Currently, as you know, this is a very strained, not just public health environment, but for folks who are advancing health equity work, it's a very strained environment and dynamic that we are living through currently. And so right now, that looks like providing support that people need to continue doing the work. What's going to help folks not burn out? How are we going to continue making partnerships, making connections, and developing relationships where we're at a time where folks just want to have a moment of peace, right? So within that network, we're often doing things where we have something called community gatherings, where we just get a time to come together and think about ourselves. What do we need to fill our cup? Right now, we're doing a series focused around using love as a tool to continue sustaining these partnerships and sustaining in this work. We're doing that in partnership with Dr. Darrell Brooks, who is really monumental. We call him the love doctor, but having him facilitate some of those sessions is really important for us. And just having the space for folks to have conversations, to really think about some of the things that you don't have the opportunity or time to think about in public health work. So we're really focusing on building up leaders in a way that sometimes folks don't think about, is the individual themselves, right? And how do those individuals also support the partners that they're working with, and realizing that you're not just someone who comes to work and your whole life is not built around making this program run, right? You have other aspects of your life. We all do have other aspects of our life that we need to have refueled so that we are able to continue staying in health equity work. And after the pandemic, I think it's really important to acknowledge that so many people in public health felt a sense of burnout. We had a large transition of folks leaving public health because of the impact that the pandemic response had on people in public health. And so this is really a time that we need to be thinking about, how do we lean on one another and really depend on one another? And that kind of seeds into building deeper relationships where people are then able to partner and to work together. And again, in public health, sometimes we're like, oh, of course, partnerships, but we don't treat our partners with a lot of respect, right? Or like any other type of relationship you have in life. But that's one thing that we try to focus on, and some of the work that I do is when you are developing a collaboration, right, you have to treat any kind of partner, whether it's a funder or a community resident, right? You want to treat them like you would any other kind of relationship with respect, listening, caring about their well being, and really having some kind of interest in what they're going through on a day to day basis, checking in on them. See, but instead, I think in public health, we do a lot of transactional work. So that health equity community collaborative is really about building a network that is a community that cares for one another, that says that everyone has a space in this public health world, but we want to make sure you have the support you need. Another program I'm working on is called the Community Based Workforce Alliance. And this is an organization, or I keep saying organization, but an initiative that really looks at advocating for community based workforces. And this group can be anyone from community health workers to navigators, doulas, midwives. You can be a home health aide, but anyone who is really working directly on the front lines, as they say, with community members, providing services in community spaces. These individuals typically have more trust, but less resources, right? And in an environment that we're in now, where we see lots of funding being taken from community health and primary care, we know that folks in our community spaces, these caregivers, community based workforces, are doing a lot more work than they have the resources to do. So we're advocating for some sustained funding, right? A lot of the funding has been pulled away from the community based areas after the pandemic. So we're advocating for sustainability within that space because local work matters, right? And individuals who were, deemed essential workers are essential and still need the funding. So we're really working with are doing a lot of advocacy with individuals who are actual community based workers. Oftentimes you see organizations just advocate for, say, I'm an ally for, but we really are convening individuals who are the home health aides or are the doulas, are the CHWs, and working with them to develop solutions for advocacy. When we talk about advocating for different priorities, it's not something that we developed. It's something that we have sat down and had a conversation with other community based workers and had that conversation. And we're elevating that and working with them, again, providing the tools that they need to be the voice at a national level.
So I absolutely love everything you said. I have a question, but before I do, I want to just acknowledge what I think of as I will refer to getting back to sort of the old fashioned things that are forgotten and what works when it comes down to relationship. And I was leading a workshop recently, and it was really about ethical considerations when conducting qualitative research studies with the community. And in the discussion phase, the question came up about how do we really connect when we've got all these interruptions and stressors and so forth. And my response was really getting back to the old fashioned techniques and qualities that work and that they still work. And you described them to a T, like sitting with the community. And I say this often, but during the roughest phase, right after this shift with this political administration, we were all in shock trying to figure out. I spent a good bit of my time just sitting with my clients and with community, like just sitting there, connecting on things that weren't directly related to a project or the work, but just, like you said, the focus of love. Those are real leadership qualities and strategies. Like we really have to think of self-care and pausing and relationship building as a old-fashioned strategy.
It's unfortunate, but yes.
But really thinking about like connecting over a meal and learning about people's interests and families and we're talking about groups of leaders, like being able to connect with leaders in this way, these community leaders, partners, and then we're able to focus to the work. Like, okay, how do we? Because it's a sustainability challenge right now. We're so burnt out and trained, like, but we really have to move away from the transactional part. I mean, that's important, but maybe pause on that and interject some of these relational strategies and skills that are just old fashioned things that work. My mother used to feed people all the time, and that was the thing. We, break bread and have conversation, and then we can talk about what the problems are. Let me fill your belly and give you a chance to rest first.
Yes. And we like to say that having those conversations is actually a part of the work, right? And so if you think about it like that, then it doesn't feel like, something, that you're not used to, or that's not supposed to be. It's supposed to be embedded, treating people like they are humans, right? It's something that we have kind of got away from sometimes. But yes, it's so important.
Yeah, I love that. And it led me to, as I was listening to you, and I'm also reflecting over so many conversations that I've heard around equity. So many people can't even say the word, people are dancing around the word. I am hearing this organization, I mean, this is a part of the fabric, and this is the work that you do. However you phrase it, whatever you're doing, you're continuing to do this work, you're advocating for. How have you addressed, I mean, you personally, but as an organization, how are you addressing some of the challenges? And I'm sure you are aware of, your colleagues and other organizations that may look at you and say, you get to still do this work, and feeling like maybe they can't do the work, or they're, really restrained. I just am curious about your thoughts around that.
Yes, that's a great question. I mentioned that I am in Nashville. So you could say that you're doing health equity work, but what does that really mean? And I think a part of continuing to do health equity work is also about really understanding what are we really talking about when we dig a little deeper. When we get to those conversations, I think that's where the magic starts to happen. We can't just continuing to label it on the surface as health equity in general. We have to go a little bit deeper and talk about what that actually means. So, one of the major reasons that Health Leads is able to continue doing health equity work is because of our funders, our philanthropic partners. And I think that's so important to say. I don't blame anyone for switching up how they talk about the work, or even switching up the work, right? Because I understand, especially in a nonprofit setting, you need to be able to stay funded. That's just the reality of it. We want to continue to do the work, we have to stay funded. And so being able to sit down, I know some of our leadership was able to sit down and have conversations with not just our funders, but also our board. And, to talk about how things are changing, just to address the elephant in the room, right? We know things are changing, but we still want to be able to do this work. And here's what we're doing in this work. So being able to describe it, health equity, obviously, it's not about giving everyone the same thing, right? It's about making sure that everyone has what they need to be able to achieve health. And that is really the mission of Health Leads, right? Ensuring everyone has what they need to be healthy. When we talk about what does that look like? Is it about ensuring everyone has access to food, maybe housing? You know, Getting to the root of what it is that we're trying to accomplish has been very important for us. So, not only do we have to talk about it differently, I think we have to be able to describe it, to paint a picture, to develop a narrative where folks are able to understand this is about everyone. It's not just about one group of individuals. This is about ensuring that, again, everyone has what they need. So I think that's a really important part, is that we were able to have those conversations with our philanthropic supporters to ensure that we were able to continue to have their support to do this work. And then again, having leaders who are in those spaces who are willing to say, okay, I want to either learn, or I understand, I get it. I understand what health equity is about, and I want to continue to support this. And that's really important as well. I would say on a local level, because I do work locally, you do have to be very strategic about how you have those conversations. And again, I just see that as a part of doing the work, right? Having those conversations, if it takes a little longer, if you have to go about it in a certain way, as long as we're getting to the same point where we're wanting to ensure that everyone has the resources that they need to be able to achieve health, is really important. And here lately in Nashville, that has led us to talking about housing, and especially for children. And in Nashville, we are really in a housing crisis, like many other cities as well. But we've had, every year there's like a turnover of children that have housing that is not stable. And I think sometimes when folks think about this issue of affordable housing, they paint an image in their mind that they may think about someone who, is sleeping unsheltered at night. But they don't think about the child, right? The child that may need to go to school the next day, the child that may not have had a meal prepared in the kitchen for them, the child who may wake up and have to also walk to school, right? Where is that child sleeping if them and their family and their parents don't have a stable home? And so it's kind of really getting down to, what do you mean health equity, right? What does that look like? And I think that's really important.
Thank you for that. And I agree with you. I think that, I like how you've included that important piece of communication, really connecting on a human level. If you can connect connecting the meaning of health equity, but connecting people on this human level, not getting caught up in something that can be a little triggering or trending and brings out, people will put up a block all of a sudden when you say a phrase because of outside, things they've heard or interpreted, as opposed to talking about what this really means. Of course, we care about the health and well-being of, especially if you can start giving examples of people, because everyone's going to know someone, in their immediate family or neighbor or friends or people, their circle of people they care about, that they can identify when you connect the meaning and the story and what this, the cause, then you're just connecting on a very human level. And I think that communication, like you said, sometimes it takes a little longer because we spend a little bit more time explaining and having the conversation, but it's worth it.
Yeah. And like you said, everyone knows someone, if not that someone being themselves,
Exactly.
And that's in public health. I think we don't realize that maybe there are some folks you work with on a day to day basis that you don't really know everything they've been through. They may have suffered from food insecurity. I recently learned that a colleague of mine was homeless twice. They did not have stable shelter. And I would have never known if they didn't tell me, like, hey, I used to have to sleep in my car. And we just don't think about who are the individuals that are going through this. And I think we try to paint a picture of like, oh, that's not me or anyone I know. It's like, no, it's exactly the people you know.
Right,
This is all
exactly.
of us.
Exactly.
Yeah.
Excellent, excellent point. This has been such a great conversation, and I wanna be mindful of our time, so I just have one more question for you, and then we'll kinda start to wrap up. Our audience of this podcast is pretty diverse. We've got students, we've got professionals of all levels, and a pretty global audience as well. Is there a bit of advice that you could give to someone who may be listening that would encourage them during these really challenging times in public health?
Particularly for right now, I would say remember what brought you to public health. Right now, we are, like I mentioned, we're going through some trying times. Funding might be shifting, priorities might be shifting to align with other things, political climates are changing. But one thing that does not change is the need for public health. Folks have, with the talk around education and how public health degrees are classified, there is a talk of, well, does public health matter? Or is it a career that people should pursue? And certainly, right? If the disparities have not changed, if the health outcomes have not changed, there's still a reason for public health. And I think that is one piece of advice that I would give folks is remember what the need was and what experience you had that brought you to public health. And until that is gone, remember that there will always be a need for public health.
Yeah, thank you for that. I would love for you to I'm gonna throw this in here too, because you and I talked about this before hitting record, but I'd love for you to just add in a little bit about because you also, in addition to this work that you do for the organization, you also provide consulting services. So could you just briefly touch on what those services are? And I'll make sure that we have links to connect with you and everything in the show notes, but someone listening may have a need for those resources.
Well, thank you for mentioning it. And I will say my website is jacquelynsimone.com. But what I provide is, again, the ability to bring people together to talk about strategy, but also get to action, right? It's a lot of facilitation. But one thing that I provide is a training, and I would say also an interactive training around culture humility. Culture humility is something that is very near and dear to me as well, because I believe that it is a tool, it is a key, it is a capability that allows you to work with people from different cultures. And so that's something that I talk about a lot or provide a lot within my consulting, again, facilitation, and also facilitating folks through strategic conversations when you are working with cross sector partners. Sometimes it helps, like folks are like, well, why do we need a facilitator? Well, sometimes it helps to have someone there to be able to help structure and give a little bit of facilitation within the conversation so you are getting to the goals and to the action items that you would like to walk out of the meeting with. And so that's what I help partners do.
Oh, okay. Well, thank you for sharing that. And like I said, I want to make sure that we connect. We'll have links to connect with you if anyone listening is interested in working with you to help them with that cultural humility piece. I think that's a very valuable resource. So I'll make sure that they're able to connect with you. And also, if they want to learn more about, your organization that you've been talking about, Health Leads, I encourage all of you to explore those resources. Jacquelyn, thank you so much for taking time and joining us on this episode and sharing so much about the work that you're doing. Really appreciate it.
Yes, thank you so much for having me, Dr. Huntley. It's been a pleasure.
Amazing. If you are a member of the PHEC podcast community, then log in and head straight to the episode activation lab. There's an exclusive follow-up conversation with Jacquelyn waiting for you there. I really hope all of you enjoyed that conversation as much as we did. This conversation is a powerful reminder that health equity means making sure every person, including every child, has what they need to be healthy. Choosing to keep saying the words and standing firm behind them matters more now than ever. Relationship building, self-care, and community partnership sits at the heart of sustaining this field through hard lessons. I hope this episode reminds you that clarity and intention in your language can be its own form of leadership, and that your path matters. I encourage you to connect with Jacquelyn and learn more about the great work that she's doing. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 470, can be found at phecpodcast.com. Once you're there, just navigate to episode 470 to find the show notes. One more thing before we go. After we stopped recording, I asked Jacquelyn one more question, and that answer is waiting for you inside of the PHEC podcast community in our episode activation lab. You'll find it in a post titled After the Mic. Remember that our podcast has an app and private community that's independent of social media platforms. This is where you can engage with public health professionals around the world. Now, in addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download the PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.